Long time, we've known that alcohol is a cancer risk factor, in particular for breast cancer, including for certain head and neck cancers, especially in smokers, colon cancer even. So we've known this for a long time, but the public didn't know. And there were many competing messages about alcohol, including related to cardiovascular disease. So our message wasn't as obvious to the general public. So it's about time that now everyone will know that alcohol drinking is a risk factor. So I'm glad to see it. So research tells us that about half of Americans know that alcohol is a cancer risk factor and the other half doesn't know. And again, they're competing messages related to cardiovascular disease, but also they're important messages about don't drink and drive, don't overconsume alcohol, because it increases the risk of people getting into fights and not being able to function well. So there were important competing messages, but now it's clear, and we need to make it even clearer to the public, that even moderate levels of alcohol drinking are a cancer risk factor. So the number one cause of cancer, including cancer death, is cigarette smoking. Very rapidly, obesity, inactivity, and poor diet, that constellation is number two, and it's about to overtake number one because we've done such a good job in the public health community of reducing smoking. Alcohol drinking in places like the US is number three, accounting for maybe about 5% of all cancers. Ethanol can increase levels of HDL cholesterol. That's good cholesterol. And so that was one of the reasons why it was thought that alcohol drinking would protect against cardiovascular disease. At this time, the benefits are not, they don't outweigh the risks related to alcohol drinking in general. So we have to think about alcohol and its effects on so many health states and people's ability to be productive in society. So if you take everything together, the small benefit related to cardiovascular disease doesn't outweigh the other potential harms of alcohol drinking, including drinking at moderate levels. So it depends on the cancer, on the amount or the frequency of drinking that's related to risk. So for colon cancer, the level of alcohol drinking that increases the risk is a little bit higher, but for breast cancer, it's lower. So 1 drink per day and possibly even a lower amount of drinking is associated with breast cancer risk. And the risk increases with increasing amounts of alcohol consumed. Yeah, so the main message that the public should know is that alcohol is a known human carcinogen. We have control over our choice to drink alcohol or not. And that if someone wants to have a little bit of alcohol because it's just part of their lifestyle, then they just need to do the calculations for themselves. If they want to have, a celebratory glass of champagne, then that's reasonable. But what they need to think about is sort of long-term daily consumption and how that may influence the risk of cancer and other chronic diseases.